So I'm Justin Bekelman. I'm a radiation oncologist and health services researcher. And our group is generally interested in identifying low-value healthcare and incentivizing or evaluating projects that incentivize high-value healthcare, particularly within cancer care. And our group is loosely comprised of Andy Epstein, Mark Pauly, Fran Barg, Andrea Troxel, Zeke. And you too can be part of the group if you find any of this compelling. So why cancer care? Well, second to heart disease, the national expenditure on cancer care is $125 billion. So this is a big pot. Within cancer care, breast cancer is the most prevalent women's cancer, the second most prevalent cancer in the United States. And its share of cancer expenditure is the highest. It's 15% in 2010, projected to be 14% in 2020. And our particular interest is now defined within early stage breast cancer, which is about 60% of the patients. And of those patients, 2/3 of women receive breast conservation therapy for breast cancer, which is lumpectomy, in which the cancer is removed from the breast, followed by radiation therapy. This is what I do in my clinical time. Radiation therapy is given once daily for a period of 3 to 7 weeks. The Choosing Wisely campaign has identified 5 things that physicians should question within radiation oncology, within my field. One of them, number one, I should say, was around post-lumpectomy breast cancer. And it says, don't initiate whole breast radiotherapy as part of breast conservation therapy in women aged greater than 50 with early stage invasive breast cancer without considering shorter treatment schedules. That language was highly worked up by a very large committee. What that's basically saying is the evidence shows that 3 weeks of radiation is equivalent to 7 weeks. We undertook a study. This is the first study of its kind within breast cancer. We undertook a study in partnership with HealthCore, which is a wholly owned subsidiary of WellPoint. HealthCore is almost like an Optum competitor. We identified a cohort of 15,000 women with early stage breast cancer, and we counted the number of treatments they had. So the 11 to 16 group would be considered the 3-week group. Anything above that would be considered the extended treatment group. And what we found was that in the United States, through 2012, only 6% of women receive short course radiation, even though it's more convenient, therapeutically equivalent to long course, costs less, and patients prefer it. We also looked at health expenditures. So from this area is plan paid. So radiation therapy health expenditures were roughly $7,000 to $8,000 different. Total expenditures roughly $6,000 difference. Again, this is all plan paid. When we looked at patient out-of-pocket expenses, there was no difference. In other words, we interpreted this to show that patients had maxed out on their copays, deductibles, etc. So when I say it's less expensive to do 3 weeks of radiation for the health plan. But unfortunately, the patients don't see that. So the implications of this, we've now identified the area of low-value care. The implications are, what do we do? And so now we're planning a bundled payment demonstration project within a payment reform research study. It's happening, our work group is being presented in May. This is sponsored by the Department of Health Policy, Medical Ethics, and also the Department of Radiation Oncology. And it's including payers, WellPoint, United, Aetna, CMS, several providers who we're going to take as our petri dish. Hopefully they'll volunteer as guinea pigs to participate in the study. Each of these providers has about 100 radiation therapy facilities as part of their group. Breast cancer specialists who give us a sense of where care quality matters. Patient representatives, National Breast Cancer Coalition. The radiation EHR vendors to help us try to manage the workflows as part of the project. And then, of course, the professional society, American Society for Radiation Oncology. It is a multidisciplinary project within Penn, including the Department of Medical Ethics, Health Policy, my department in Radiation Oncology, Division General Internal Medicine, Division Family Medicine, Wharton Health Econ, CHIVE, and LDI. Thanks.